So hi everybody, as everybody arrives, I'll just introduce myself. I'm Ben Wheeler and I'm going to be chairing the session today. Hope you've enjoyed the chat between me and Danny and Kate as we've been, as you've all been arriving. We'll just wait a minute or two and then we'll get started. But just to flag up that this webinar is being recorded. And we'll make the recording available on our hub website sometime shortly, before too long. We'll just give people another minute or so to arrive and then we'll get started.
Considering how hot it is, it's nice to see so many attendees not on the beach.
Good point. Hopefully this will be a good lunchtime diversion. Hi Ian, yep, sure, I will copy that link into the chat. Okay, well, it's a couple of minutes past 1, so I think we will get started, if that's all right with everybody. Welcome everyone to this, our next sweep, Investing in Nature for Health webinar, one of a series that we've been holding in association with our project around investing in nature for health and how we can make the most of the evidence that we have to inform how we invest in the environment to support and promote human health and well-being, with the intention for mutual benefit for both people and the environment. And today I'm really delighted to be able to introduce two excellent speakers. We're hinging this webinar around two pieces of work actually. So one carried out by us as part of the SWEET project and one carried out by Danni Sinnett and her colleagues at UE. Both around the issue around green space and adolescent health and well-being. So Danni and colleagues have conducted a systematic review on the relationships between natural environments, green and blue space, and adolescent mental health in particular. So Danni's going to first of all be describing that piece of work, and then I'll hand over to Kate, who will describe a piece of work that we've done that's kind of around the same kinds of issues, but actually more around practical implementation, with the sort of subtitle, more than just skate parks, what are the things that can be done in our green and blue spaces to support and promote their use and the benefit for particularly for adolescents. So hopefully that all makes sense. Please do, as we go along, use the Q&A button to enter your questions. It's easier to do that than if you use the chat window. So hit the Q&A button and enter your questions. Feel free to do that as we go along. And then once Danni and Kate have done their presentations over the first sort of half hour, 40 minutes, then we'll have time for some Q&A discussion amongst the three of us with your questions that you post through the Q&A channel. So please do that as we go along. So without further ado, I'm going to stop sharing my screen and I'll get Danni to share yours if that's okay.
Yep.
And I'll introduce, Dr. Danni Sinnett is Director of the Centre for Sustainable Planning and Environments at the University of West of England in Bristol. And she's an associate professor in green infrastructure. So Danni's got a wealth of really relevant experience to these kinds of topics. And it's great to have you here, Danni, to talk us through this piece of work that you've done recently. So handing over to you.
Thanks, Ben. Thanks for the invitation and thank you everybody for coming. So as Ben said, I'm the director for the Centre for Sustainable Planning and Environments at UE, and this piece of work was led by my colleague Izzy Bray, who's in the Public Health Research Centre, who couldn't be here today, and in collaboration with Faith Martin, who's at Coventry University, who's a psychologist, Rob Hayward and Rebecca Rees as well, who are at UE and are psychologists. So this is a piece of work that we were commissioned to do by the Wellcome Trust last year. And just to give you a bit of background of the kind of overall Wellcome Trust programme, this was part of what they've called their kind of active ingredients work stream. And last year they funded 30 projects, and there's another tranche underway at the moment to look at the active ingredients for treating, managing and preventing anxiety and depression among young people aged 14 to 24. And they've picked that age range because that is when most people with anxiety and depression will have kind of first developed those conditions. There's a link to their programme there. And so we were successful in our kind of bid for one of these. And we were looking at exposure to green space, particularly in urban settings. And we did this kind of over the summer last year, which, as you can probably imagine, was amazing timing. And so what, you know, our kind of pitch was in our bid was that we have, you know, nearly a billion 14 to 24-year-olds living in urban settings, and we know that urbanisation is a risk factor for poorer mental health. There are already a number of systematic reviews looking at the relationship between green space and health, but there aren't any, or there weren't any, that were specifically targeted at this age range. So they tended to either look at children or adolescents or adults. And also a lot of the existing reviews were quite narrow in terms of the types of green space that they were looking at, which from, you know, my kind of perspective, working in the built environment, you know, we need to know a little bit more about the types of green spaces that we need to be providing. And they often also kind of missed, you know, we were interested, so this was kind of a systematic review, but also our kind of pitch to Wellcome Trust was that we would also be looking at developing a kind of conceptual model. So we wanted to be quite broad in terms of the literature that we looked at, and look at more at the kind of mediating factors as well that might be relevant for this age group, to try and kind of piece together the bits of the jigsaw. So existing systematic reviews tended to focus on papers that had the access to green space right through to anxiety and or depression. And we wanted to look at those that also did bits of that process. And obviously, you know, we put this in just before COVID last year. And obviously this kind of agenda has become much more important over the last kind of 18 months, as you know, there's been lots of reports about access to green space and its importance during the lockdown, when it was often the only things that people could do, and particularly how that's impacted on mental health. And we, I guess, kind of hung this on the attention restoration theory, as you know, lots of the previous reviews have kind of looked at that, but from a psychology perspective, they haven't particularly looked for clear links to clinical levels of anxiety and depression. So we had a focus particularly on those clinical levels as well. So essentially we were looking at the impact of exposure to green space, taken quite loosely, with anxiety disorders and depression. So our objective was to think about in which ways, in which context, and for whom does exposure to green space reduce the risk of anxiety and depression among young people aged 14 to 24 living in urban settings. So we looked at three, in our kind of search strategy, we had sort of three elements. One was about the green spaces, and we looked quite broadly at the search terms. So we were looking not only at parks, we were also looking at exposure to vegetation kind of in and around the neighbourhood. green streets, interventions that took people out of urban settings and put them in greener environments. The second set of terms were about anxiety and depression. We also include stress and low mood because they're kind of on the pathway to anxiety and depression, but we removed, we didn't include some of the terms around kind of quality of life and those sorts of things. And we looked at all study designs, so reviews, experimental, observational and qualitative studies. And we used a scoping review, and there's a link there, I'll try and remember to put it in the chat, to inform our search strategies. But also we worked with 2 groups of young people with lived experience of anxiety and depression, and we consulted them kind of throughout the review. First, to get their kind of thoughts on the search terms. So was there anything missing from the literature or from our scoping study that we should be including, and also to test our findings with them to see whether or not they could add any of their insights to that. So we started off with, after the kind of putting these search terms into the databases, with just over 9,000 titles and abstracts, which we whittled down to just under 700, very frustratingly 699, which were full text assessed. And those then were further reduced to 86. And the main reason for that was the age range. So, the titles and abstracts didn't often make it clear what the age range those papers were looking at was. And so we had to look at the full papers. And we had lots of internal discussions about what age range to focus on. And we decided to go with papers where 50% of the population was in our target age range of 14 to 24. So some papers just provide an average. So, if the average was much greater than that, we didn't include those in the review. And then basically 86 was far too many for us to review in detail in the time that we had available. So we targeted which ones to look at out of that based on the 4 criteria that you can see there, and we ended up with 47 in total included in the review, which is a much greater number than some of the existing systematic reviews. So we looked for those that met 2 out of the 4 criteria. So either that they looked at neighbourhood green space, so that was our kind of priority, was urban populations, that they included clinical measures of anxiety and or depression, that all participants were 14 to 24, so not just the 50% that we had for the first kind of tranche, and that they were intervention studies. So if they met 2 out of those 4 criteria, they were in. So for example, if we had one that looked at neighbourhood green space, but not all of the participants were 14 to 24, and they looked at mood and it was a cross-sectional study, it would have not been included because it only met one of those criteria. So we ended up with primarily with 28 experimental studies. So studies that measured, for example, state anxiety levels between people in urban streets, urban forests, urban parks and forests, for example. 11 studies that looked at outdoor adventure programs and training, education or employment in green environments. So these were complex interventions. 4 studies that looked at exposure to residential vegetation, and 4 studies that looked at young people's perceptions of green spaces. And one of the things that kind of came out of the scoping review was that there are a lot of, and it informed our search strategy, was there are a lot of studies out there that focus on, mainly based in the US, that have these kind of wilderness programs that take young people out somewhere, and they carry out activities in the outdoor environment, but it often also includes some pretty intense therapy and group therapy sessions and those kinds of things. So we excluded those studies because unless they made it clear what the impact of being in that green environment was, because it was really, it's impossible to disaggregate the impact of being in nature from the other things that were going on in that programme. Another set of studies, again quite common apparently in the US, is equestrian activities, so taking often girls out to do equestrian activities. So they were kind of coming up in the search, but weren't really the sorts of things that we were looking for. So you can see here that, you know, we have a dominance of studies primarily conducted in Japan and other Southeast Asian countries that compare urban streets with traffic with forest settings. A couple that look at urban streets with traffic versus large parks. One that compares forest, small urban parks and large urban parks. One that looks at urban streets with traffic and versus green urban streets, and another one that looks at urban streets with traditional buildings versus forest. So these are the experimental studies, I should say. So just to give you a flavour of the types of things that were coming out and the kind of strongest evidence from these experimental studies, I won't go into you'll probably be relieved to know the statistics, but just to pull out that these 4 studies, in a large urban park versus an urban street with traffic, we're kind of thinking about 14 to 19% lower state anxiety scores after 15 minutes walking in an urban park compared with the street. And the other 2 looked at forest versus urban streets with traffic, and, you know, higher levels, reductions in state anxiety, 23 to 26%. What you can perhaps see here is that, you know, these studies all were working with students, and 3 out of 4 of them were solely with males. 1 of them was solely with female students, all Japanese students. And one of the things that Wellcome asked us to do was look at the impact on different socio-economic characteristics and other kind of mediating factors. And most of the studies didn't compare between different, you know, between different characteristics, between ethnicity, between sex, between socioeconomic impacts. Some, as you can see here, some studies only had participants who were male or female. Others had mixed, but then didn't take that into account in their analysis. A couple that did found, for example, in a kind of outdoor adventure program, that the male participants had reduced levels of anxiety, whereas the females had higher levels of pre-intervention anxiety. So there are some important differences between groups, but none of the studies particularly looked for those. And we used all of this information to develop this very complicated looking conceptual model, which again, I'm not going to go into a lot of detail, but just to draw your attention to a few things. So, you know, the features of the green spaces were focused on exposure to vegetation in the neighbourhoods, trees, scenes of nature, sounds of nature, and exposures to forests and parks. And you can see the kind of the thicker lines that are blue, orange, brown and green at the bottom stop at relaxation and state anxiety. So we don't know from this evidence how then that relates to an anxiety disorder and depression. We were also interested in that kind of box looking at the psychological processes. So if we've got the features of green spaces, we've got, you know, the perceptions, the behaviours, and we've got this impact perhaps on state anxiety, depression. We don't know what the processes are that are going on in the middle of that, which was something that Faith, our psychologist, was particularly interested in. We then added to this based on literature in adult populations and also from talking to our participants with lived experience of anxiety and depression. And what that kind of told us was that there is probably something going on around those perceptions, and that then impacting on the use of green space, which I guess is kind of quite intuitive really. But also that there is, you know, the young people that we spoke to talked about the benefits in that kind of middle box around psychological processes of being in green spaces, allowing this kind of interrupted rumination. So the kind of, you know, bigger picture stuff, not worrying about things, those kinds of things. And also less negative stimulation. So they talked not only about the contact with nature or with green environments as being beneficial, but also that then meant that you weren't, you know, on your phone interacting with social media. It was less noisy, there was less traffic. So it was not only about the green environment, but also about the absence of other things and the restorative effect of that. So the young people talked about how, you know, they took their phones with them to a park, but they left them switched off and they were just there kind of for emergencies. So overall, the exposure to forest environments particularly seems to lead to greater momentary mental well-being compared to being on an urban street. And this momentary is really important from an anxiety and depression point of view, because the studies just looked at the impact kind of almost immediately after exposure. So we don't know how long that benefit is maintained. Urban parks can deliver similar benefits to urban forests, but there's some evidence from that one study that larger and longer lasting effects come from forests. And these studies had a range of different kind of doses, for want of a better word, so time spent in these natural environments, so between 15 minutes to 3 days, and kind of related to the point above about the kind of follow-up period. We don't know from the evidence kind of how the lasting impact of this. So is it okay to go to a forest for 15 minutes once a week, once a month, or do you need to go every day? You know, if it's 15 minutes versus 60 minutes, do you get, you know, 4 times the benefit? You know, there is a lot of uncertainty about how much is enough from this evidence. And as I mentioned, it's also about the kind of absence of things that that being in green space provides, so absence of traffic, etc. And the young people that we spoke to said that this kind of enables them to notice nature more, which then enables kind of mindfulness, interrupted rumination, and then restoration. And we've summarised the findings on the blog there. So in terms of our kind of recommendations that we took to the Wellcome Trust, we feel that there needs to be opportunities for activities in these spaces that are kind of built into school and college curricula. So not just kind of assuming that this will happen without, you know, kind of accidentally almost. That neighbourhood green space and vegetation is absolutely crucial. I guess kind of probably I would say that, probably you would all say that as well after the last year. You know, young people have lower access to personal mobility, lower car access. They often have lower access to private green spaces and have lower access to the kind of the money that you need for public transport. So it's really important, particularly for that group, that they have access, you know, where they live. And this is a kind of structural change, so it needs to happen kind of across the board, not just, as I say, assuming that people will, you know, kind of be motivated to walk to their park. What we found coming through the literature and talking to the younger people is that often young people don't appreciate the benefits of being in green spaces, or they underestimate the benefits of being in green spaces. So it's really crucial that we make sure that we, you know, kind of facilitate their use. And obviously we all know that green spaces provide lots of other benefits in terms of thermal comfort, biodiversity, etc. And also in terms of the other welcome active ingredients that they funded, we kind of presented to each other across the 30 studies. And what was really interesting is how many of the other active ingredients could be enabled by green space. So things like more bodily movement, more physical activity was one of the strongest relationships that we found in the review. So green space can provide an opportunity for more physical activity. Relaxation can relate to improved problem solving, you know, engagement with positive activities, so, you know, community work, food growing, doing physical activity, meeting friends, etc., can increase social relationships and social cohesion. So two of the other active ingredients that were being looked at. So it's not just about the green space kind of in of themselves, it's also about the behaviours that they support. Okay, and that's me. This is in Belfast, this park, which is near where my in-laws live.
That's great. Thanks very much, Danny. Really appreciate it. Clearly a really important study and very timely. Just while Kate starts sharing her slides, we'll hold most of the questions and the discussion until the end of the session. But I'll ask one question that's come in. This is from Maureen. Were there any studies looking at different effects of green space on different types of anxiety disorders? So, for example, generalized anxiety, social anxiety, panic disorder.
I don't think so. I'd have to go back and double check that, but I don't think so. There weren't that many studies, as the kind of diagram showed, that actually looked at anything other than state anxiety. That was the main anxiety related outcome that the studies looked at, but I'd have to go back and double check that.
Sure.
I'm not a public health person, so I don't want to say the wrong thing.
No, that's great. Thanks, Danny. That's great. And we'll get on to some other questions for you in a bit. But for the moment, let's hand over to Kate. If you can start sharing your slides, Kate, and we'll move on to the second part of the webinar. So this is built around our new publication, which has come out today, on more than just a skate park, a sort of a really nice follow-on from the work that Danny's presented already, around a kind of a review and practical guide on how to make urban green space more accessible to adolescents particularly. So Kate works on our SWEET project and also works for the conservation charity Plantlife. So Kate comes at this from some different kinds of perspectives. It's great to have you here, Kate, and I'll hand over to you. Thanks.
Thank you very much. So as Ben said, I've been working with SWEET on and off for the last 4 years, and I'm also a community scientist for Plantlife in the Southwest. And one of my roles is taking out students with low-level mental well-being to the woods to do citizen science. Just to kind of set the scene of this report and where it came from, a few years ago, I was teaching at a college in North Devon, and some of you online who have taught before or are teaching may remember your kind of first anxiety about teaching being about being imposter syndrome and maybe not knowing enough about the subject. But when I started, that kind of flew out the window because the biggest issue was the level of anxiety and depression in my students. And I just wasn't prepared for it at all. And it was quite difficult. But also at the same time, I was teaching in North Devon, which is a UNESCO biosphere designated because it has fantastic landscape, wildlife and environment. But my students and the larger cohort at that college are just not accessing the environment. And it took me quite a long time to understand what the barriers were. So that's kind of where this report has come from. And it is all about adolescents and some practical guide on how to help them access green space. So hopefully this will move on. There are 8 key areas covered in the report, and these have come from the review of the literature, so academic and then lots of case studies that we have read. And they are a co-designed approach, social space, nature, safety, Wi-Fi, art, events, youth council, and then at the end we have a what's next section. With the co-designed section, I'm just going to run through a few details of each one. I imagine lots of you sat on the call have done lots of co-designing before of projects with partners. So I don't want to teach you how to do it, but just a couple of things that have come out of my review that I do want to highlight. So here I've got a circle of how to do co-design. You set up your conditions, you find the experience and gaps, discover, design, you have an iterative approach, you implement. And then the one thing that we really noticed, which was missing from a lot of the case studies, was monitoring. So there's lots of fantastic implementations of things for adolescents all around the globe, but there's a real lack of monitoring and going back to see, are those new resources, are they being used? Is it having a positive impact on the targeted audience? That's kind of really missing in the literature. So I would just kind of emphasize, if you are thinking about doing anything specifically for adolescents, to add in monitoring. The other thing that I wanted to highlight was some of the key principles. These have come from a study of co-design projects, not just for adolescents, but across the spectrum. But a couple of the two key principles that I personally have also witnessed seem to get dropped in projects is making sure anything that's implemented is transformative. So if you're doing co-design, what's the end goal, and is there resources to do it? There's always so much energy involved in setting these things up, and people have fantastic ideas. But if nothing ever gets made or changed by the end, you then lose a lot of that energy. And the other thing is to have these sessions properly facilitated. And I was lucky enough to do some facilitation on a different suite project with the public, and having really good facilitation does make a huge difference to the success of some of these projects. The next section is about social space, and Danni mentioned this as well in what she was saying, that young people really are restricted in the space that they can go to. They generally don't have access to a car. If they're under 18, they can't go to certain places like nightclubs. Green spaces sometimes can be locked up and difficult to get to. And then there could be potentially lots of restrictions on how to use that green space. So there's a fantastic organisation called Child in the City, and they've been working with young people to find out what would make green space work for them. What are they looking for? And one of the things they emphasise is their adolescents is they want a space for them to hang out, but they don't want it to be cornered off, hidden away. They want to be part of the park, part of the community of people who are using that space. They want to be integrated into the park and feel that they are welcome there and can enjoy being with everybody else. They want a place to hang out. They want playful elements that are designed for them. So lots of play parks are generally for children with children's equipment, but they would like elements more suitable for their age. They also mentioned ball courts, fitness and climbing, and social seating. And I found a really good example of a couple of these below. So bottom left is an organisation called Ping England, which is funded by the National Lottery and Sports for England. And they loan community ping pong tables around the country. And I've used a couple of them in Bristol. And in the southwest, we have 150 of these set up in community spaces. So that would be parks or potentially like village halls. But one of the key things about the eligibility of these ping pong tables is, going back to the previous slide, is you do have to monitor them, because they are also aware that they want data on who's using them. The picture on the right is from Boston, and this was an installation, temporary installation installed for adolescents to use, and they were specifically designed for adolescents. So they are light up swinging seats, and you can see they're kind of high off the ground, so you wouldn't get young children sitting on them. But they found that particularly female adolescents really enjoyed using this space, and it was successful enough that they moved it around the city to make sure lots of people got to use it. the other thing I've got on here, this is a quote from a teenage girl from Scotland in a report from 2010, and highlighting the name of the report. She says, "I don't use skate parks because I don't have a skateboard and I do not like skating. I'm a girl and there's not a lot of activities for us, very unfair, and that is why we don't get outside as much." And I think previously, for parks and councils, they would think, oh, for teenagers, teenage provision, we'll get a skate park or a BMX. But there are lots of adolescents who are not comfortable, feel intimidated going to skate parks, and it doesn't meet a wide kind of need for young people. It's just a specific crowd who like skating. The next section is about nature, and as Ben mentioned, there's something quite close to my heart, but I feel like this is happening already. So across the literature, adolescents are saying they want to be in nature. They aren't specifically able to articulate what about it or what parts of nature. So there isn't anything that says, oh, we want to be in lots of trees, or we particularly want planting of foxgloves or poppies, but they do say they want to be in nature. And I think all of us living in the Southwest will notice that there has been a change over the last few years of more wild planting coming through into our urban areas. In Exeter, there's a fantastic project, Exeter Wild, which is run by Devon Wildlife Trust. And if any of you drive through now, you'll see by one of our cinemas, there's an incredible roundabout, but there's also in residential areas some beautiful wildflowers that are coming into their own at the moment. The picture bottom right is Sidmouth, where I used to live, and they've installed a sensory garden. And this has been really well designed to be part of the journey for residents coming down from higher up in the town and walking down to the seafront, which is obviously very popular. They will walk through the park where there is children's equipment, and they'll get to the sensory garden, and the whole community, you will see, will be touching and feeling and smelling as they go through, because it was designed for people to touch. And not just adolescents, I think everybody benefits from this fantastic area. And the picture on the left is a park in Dublin where they've completely replanted a bank and covered it in foxgloves. And again, people living in the Southwest will see foxgloves all the time, and they're fantastic for pollinators. We're busy with bees going in pollinating. And the local residents are really enjoying that feeling of being in nature. So in the report, we mention including wild planting in kind of management plans going forward. But I feel that this is already happening through lots of different projects, particularly in Plymouth, at Derriford Park, and in Exeter, and lots of other projects around with No Mow May. So I think, yes, we're doing this, and young people are really appreciating it. It was also mentioned about blue space, and when we sent this report off to colleagues to have a review, again, it was highlighted that we didn't mention blue space in the report. A colleague of mine who works for the WAVE project in North Devon has just had a paper published all about the therapeutics of coastal space, particularly framed in COVID, but I would recommend having a look at it as well. I believe it's open access, so you can see some of the work that's going around with blue space. Safety is a huge issue for adolescents accessing green space. And in the report, we only cover two aspects of safety. We talk about maintenance and we talk about lighting. Maintenance is a very big issue, and with the recession, there's been a lack of funding going into parks. And every couple of years, the Heritage Lottery Fund does a report on the UK public parks, the state of the parks. The last one was 2016, and at the time, park managers reported 53% of parks were in good state. So that's a huge amount of parks that are struggling with meeting their maintenance costs. And the effects of that, they say, are safety, vandalism, and a lack of people wanting to come to the parks. And then another study talking to adolescents in Scotland, they cite kind of maintenance issues, so vandalism, broken equipment, dog fouling, broken glass, a deterrent for them going to the parks, which is the same for all of us. We all don't want to go to a park where there's issues like that. We also mention lighting and talk about taking some of the best practice from skate parks, because they now use quite novel ways of lighting the parks as a way of communicating to the people using them. And I think lighting, again, is where it works really well to have a co-production way of using it, bringing residents and the community together to talk about how best to light, because you can have the lighting go on timers to turn off at a particular time. You can have the lighting changed to communicate that we're coming to the end of the park, so they dim or change colour. You can use the lighting to help light up dark spots, and also to help light up routes, safe routes home for residents. So when they leave the park, can they safely get back to where they live? And this is a particular issue that keeps coming up, particularly with young women who don't feel safe leaving the parks at night time due to lighting. We don't cover it in the report, but it has been brought up to us, issues of sightlines, access points, surveillance, public transport, and providing secure places for bikes, or particularly in coastal areas, surf stores. So there's other things that you can consider. So Danny mentioned Wi-Fi, or how turning off from phones can be a really good thing to give adolescents a break. But in COVID, it was very widely reported that there was a real lack of access to internet for different people, and potentially having open free Wi-Fi would be a benefit. And it's something that adolescents in always their top kind of thing they want in parks is free Wi-Fi. In the EU, they did have a grant that has just closed to allow municipalities across Europe to apply for funding to have open access internet. And in the southwest, Cornwall and quite a lot of the regions in Devon, so I think East Devon didn't apply, but Mid Devon, North Devon, Exeter, Teignbridge and Bristol are all registered to hopefully receive funding to enable them to have open access Wi-Fi in some of their open areas. But it does seem to be a very important thing for adolescents as well. We included art in the report, as again, it was something that was mentioned that adolescents want, but it kind of set off these alarm bells for me of, oh, that's going to be expensive. However, having a look at different case studies around, there are ways of incorporating art into public spaces that doesn't have to be expensive. The photos on the left are actually taken by my mum in the lockdown. She's going to her park, and there was a kind of grassroots community project of these painting of pebbles, and every time she went there was more that kept coming, and it was a bit of a trail, and it got lots of people excited to go to that local park to see and take part in painting of pebbles. The example in the middle comes from America, where they had installation just for a couple of weeks, and they got local artists and volunteers to paint these hearts, and they set them around the park in a trail. But you can add in more to that with hashtags and selfie areas, and it kind of makes it more of a destination for young people to come and see what's happening and feel like there's lots of energy around the park. The last example on the right is art that you can loan. So I'm sure we all remember when I was a student back in 2008, there were the elephants in London that were all beautifully painted, and then the elephants have been on tour, and I've seen them in Plymouth, and lots of other art that you can loan for free, or through your councils you can get discount on having art in the park. And again, it creates a kind of buzz and destination feeling around coming. And then to bring all of that together, so there's quite a few different topics, lots of parks around the globe have set up their own youth council to discuss some of these topics and issues, but also to have their voice heard. Before I started looking into what young people want, Wi-Fi was never on my list of things that I thought would be important. So I think it's really important to try and get their voices heard and communicate with the people who are making changes, so park managers. But there are easy ways of doing this. So instead of trying to recruit these councils yourself, you can go through already established youth charities and organisations, through colleges or schools, to kind of get that audience. And it can help them feel part of the community, having ownership of that park and looking after it. And they also will get some of their own skills, so how to communicate in professional ways. They get the opportunity to develop. So I think it does work. Obviously, it takes time and energy to put into these kind of things, but I think they do have a real benefit. And a really good example of this is the Queen Elizabeth Olympic Park. It was set up after the Olympics, and around the park are 4 boroughs that are quite low socioeconomic areas. So, for example, Newham is one of them, and it has perceived 50% of children there live in poverty, whereas for the whole of London it's 34%. So there's some real issues around the park, but they've set up this youth voice. And I know this summer they're running a whole host of programmes for the local adolescents to get involved in. But the council helps set these up and comes up with what they want to be covered. And they've had a lot of opportunities to talk to their local councillors and really shape what happens in the park. So I would recommend having a look at that as well. And at the end of the report, there are fantastic long length of examples of different case studies that you can look at for ideas and inspiration. So lastly, at the end of the report, we have a what's next section. And these are some questions that have kind of come from the report that we think are really important, and we'd love to hear from you and share your experiences with us. So the questions are around: how can we fund and develop the areas addressed and issues? Are there alternative sources of funding for activities focused on adolescents beyond those we've currently highlighted? So if you aren't aware, we have on our hub another resource called Alternative Funding Mechanisms. How can the inequalities of access to green space for adolescents be addressed? What are the key barriers for engagement? How can green space be managed for both adolescent health and well-being benefit, but also environmental gains such as biodiversity? What characteristics of green space makes them amenable to the diverse preferences and needs of adolescents without excluding others? And do you have any successful examples of engaging and sustaining adolescent involvement in green space activities? Great. So please do head over to the hub afterwards. I think the link is in the chat or the Q&A, and then you can download the report and have a look at it as well. Right, I will stop sharing.
That's great. Thanks very much, Kate. really nice summary of all the stuff that's gone into the report. So while you catch your breath, I've got a first question here, going back to Danny, if that's all right, and then if you've got any other questions for Kate or Danny or both of them, please feel free to add them using the Q&A button. So Danny, a question for you from Marie. Did you get any insight of negative effects of green blue space nature on mental health? In adolescence, many biological changes happen, peers become more important than ever, nature connectedness decreases, and green spaces may be a setting to try out drugs, to engage in antisocial acts. Have you got thoughts on those kinds of angles?
I mean, yeah, that's an interesting question. We didn't find any kind of evidence of negative impact, apart from some of the work around the kind of preferences talked about some of the things that Kate's just mentioned, actually, that particularly girls don't often feel safe in parks because of well, sexual violence, or the risk of that because of lighting, those kinds of things. But they weren't kind of measuring that, the kind of impact of that specifically on anxiety and depression. I guess where that is more kind of more common in the literature is more that those types of activities prevent other users, rather than particularly kind of peer prevention, if that makes sense. But I guess I would assume that, you know, and as Kate said, I live really close to a skate park, and there's one girl who goes in the skate park who my 8-year-old daughter is absolutely in awe of and basically wants to be, because she's very good, but she is noticeable because she is the only girl amongst a kind of sea of boys skating, you know, and you know, I can see why many people who aren't skaters would find that environment quite intimidating. But I guess you don't you know, the studies are of people using spaces, not people not using spaces. So you miss the people who aren't using them and why they're not using them. So yes, there isn't so much particularly on that, but I think it's absolutely, I mean, we were particularly interested in that relationship with anxiety and depression, not on the kind of perceptions and the barriers, which I think, you know, does need work.
Great, thanks, Danny. And I'm actually going to follow up that issue with a question from Andrew, which I think summarises probably one of the really big issues that Kate touched on as well, and we sort of mentioned in the report, but it's a big question I don't think we've necessarily got answers to. Andrew says, young people often face exclusion in green space as a result of NIMBYism and opposition to perceived antisocial behaviour. Does the report consider this tension? I think it does a little bit, but we definitely don't have the answers. But how do we overcome that, and how do we make spaces more explicitly inclusive to this age range? So I'll go to you, Kate, first, and then back to you, Danny, if that's all right.
I think it's very hard, and you know, behaviour change takes years to achieve. I think that's why I particularly think co-production is quite useful, to get the community all together, listening and understanding each other's voices, and agreeing certain things that benefit all of them. So when I was talking about lighting, I'm sure young people would like the lighting to carry on to 2 in the morning, but the residents who live close by wouldn't. And that's why having those discussions right from the beginning really help. I think involving the local schools and colleges and youth organisations, and getting them to feel that they're allowed to use that space, but also the community seeing it being used in a structured way, so they can see they're using it for sports or science or different things. And then slowly over time, I think those kind of will break down. But there will always be, you know, there will always be antisocial behaviour. There will always be vandalism from a minority, and we've got to live with that, but not penalise the whole of that group so they can't use that space. And it is difficult, but it takes time, I think.
Thanks, Kate. Danny, I don't know if you've got anything to add on to that.
Yeah, I mean, I guess just to echo really what Kate said, and a while ago I read some work that was from the States where they had a green space that was kind of next to an older people's home and a school. So it was kind of this boundary between the two, and it was very underused, and they wanted to increase its use but make it suitable for both kind of user groups. And they did that by having kind of shared design studios between the different people. And actually there was, you know, that everybody kind of, I guess, started it thinking these two groups would want something completely different and it wouldn't work and it would, you know, be a complete disaster. And actually there was quite a lot of overlap between what young people wanted and what older people wanted. And there were also ways of designing that space to discourage or encourage, you know, so spaces that were subtly designed to provide tranquility, and areas that were kind of more encouraging of more boisterous activity, to do that without putting up barriers and fences and allow people to kind of move freely between the two. But that only came about because they got everybody together designing those different elements. And I think also that kind of Andrew's point about perceived antisocial behaviour is really important, because I mean, I spent a lot of my teenage years hanging around in the local park in the evenings, and we probably were quite intimidating, but we would have been mortified to realise that, you know, we certainly weren't doing anything that we felt was particularly antisocial behaviour, or that you know, or that we certainly weren't doing anything threatening, but I would imagine other people perceived it like that.
Great, thanks both, really interesting answers to that really important question. Specific question here for you, Kate. Jenny asks, can you explain a bit more what you mean by playful elements? There's in the report we talk about playful elements.
Yes, hi Jenny. Playful elements is adolescents, as they're developing, they like to be braver and be a bit more challenged and risk taking. So some parks have been designed to have slightly riskier play things for them to use. So not just like a slide, but like earlier I had that image of these light up hoops that's specifically for adolescents because it's taller, so you wouldn't get like a 5-year-old sat on it. And I think that's what they're saying, they want more equipment that's a bit more risk taking for them, a bit more fun and active, and that can be anything from boulders with climbing holes on it that's slightly more challenging, so you wouldn't get younger children on it, to different equipment that, you know, you have to be a certain height to use, so it restricts younger children from using it, but it's more designed for teenagers.
Great, thanks. And maybe that's a great point for us to end on. We could probably all do with a bit more playful activity in our days, I should think, not just for adolescents. So I'm going to wrap us up so that we finish in time for 2 o'clock. Thanks everybody very much for joining us. Thanks especially to Kate and Danny for really excellent presentations, really sort of 2 very complementary pieces of work. We've posted links to all the things that have been discussed, the reports and so on, and blogs in the chat. So hopefully you've been able to follow those links and find them there. We will add the recording of this webinar and slides, if Kate and Danny are okay with that, to our hub on the SWEEP website. So that will just take us a little time to get it all processed. But once we've done that, we will send an email around to everybody who's registered for the webinar, and make sure you all have the links to follow that up, so you'll be able to get the recordings and the slides and on all the relevant links. And we're super interested, certainly in terms of the SWEEP report. We'll be really keen to get your feedback and any thoughts that you've got. As Kate said, we've left some really sort of open questions at the end of the report, and it's clearly a really important area for us to be addressing. So really keen to get your feedback and any thoughts from those of you that work in these areas as we progress into the coming years. So thanks all very much. I will leave you to get on with your days. Hopefully you can get out and enjoy some sunshine if that's what you've got where you are, and we will see you for the next one. So thanks very much everybody, and we'll see you soon.